everyone. I'm Christopher Kent, and we're going to be interviewing a very special guest today, Dr. Amy Haas. And I've had the privilege of knowing her for a little while and working on a variety of projects, and I've been duly impressed by her understanding and commitment to chiropractic and her willingness to apply her expertise. Dr. Haas, in addition to being a doctor of chiropractic, actually she was a PhD before, as I recall, from the Medical College of Wisconsin, and she's done some postdoc work, I believe, at Harvard and some other institutions. So she comes to us with a very distinguished scientific background. But the thing that really makes her special is her understanding of chiropractic. So Amy, thank you for coming.
Thank you for having me. It's an honor to have this conversation. It's always a pleasure to speak with you.
Could you tell us a little bit about your participation in the Immunity Symposium and how you got involved and essentially what it was that you shared with the audience?
How we all got involved in this is last spring, as we all know, there were some political difficulties having to do with keywords. Some of those keywords were boost and immunity. And certain factions within our profession decreed that we could not say that. And I respectfully disagree because they were not looking at all of the evidence. They were looking at selected evidence. And as a scientist, that practice really irked me, to be honest. One should not select which evidence they believe and which evidence they will put forward. And that is, in effect, a limitation. And science is not about limitation. Actually, one would argue to be limiting in that respect is unscientific. So this hit me straight to my heart as a scientist as something that was just plain wrong. And amongst many conversations with colleagues, the question was, okay, yeah, this is so not right. What can we do about this? Because we who are practicing location and correction of vertebral subluxation actively in practice, we see objectively and empirically that the effects of chiropractic care are not limited to musculoskeletal, neuromusculoskeletal. And that kind of assertion, again, is limiting. So when I notice patients who are sleeping better, breathing better, have better resistance to colds, naturally I'm going to question that and say, what's behind that? And as a former recovering scientist, I am always going to explore the question, why might that happen? And as we've discussed before, what you have written and what you have explored and what you have created in your career is foundational for my understanding of chiropractic. So when I ask these questions, why might this be happening? I look back to my background in chiropractic science and chiropractic philosophy and start to apply that to these questions and ask questions like, well, could heart rate variability be improving in these patients? And what could that actually mean? Could surface EMG be improving in these patients, or a paraspinal thermography? And what would that actually mean for not just neuromusculoskeletal, but applied to overall health? And that led me back into a subject that has held my interest since I was, believe it or not, a teenager. I was very interested in neurobiology back when I was at Bates College, a long time ago. And I used to love to learn how the chemistry within the nervous system worked. It's something that I got back to with chiropractic, which was kind of an interesting thing. But the bottom line was that I was already aware that the nervous system, the endocrine system, and the immune system are inextricably linked. You cannot impact one of those subsystems without expecting to impact the others. Therefore, this premise that the adjustment can only affect neuromusculoskeletal is fundamentally flawed. So given those observations and those thoughts, several of us got together and decided we were going to put a foot forward and say, hey, this isn't right, this limitation of chiropractic, and we need to make some really solid steps forwards to establishing and correcting that deficit.
So there are really two things that you brought to light here that I think are worth discussing briefly. One, of course, is the whole concept of epistemology. How do you know what you know? What are your criteria? Whenever someone says, well, chiropractic is no good for this or that, or limited to this or that, I always ask them, well, what criteria will you accept? And that always opens a conversation and often leads to pointing out some contradictions in their own application of that concept. The other thing is the neurobiology of neuroendocrine immune function. And, I've often said anatomists seem to like to pigeonhole things and to classify things, when in reality, when we deal with human beings and function, it's the interrelatedness that's really the magic, the notion of the whole being more than the sum of the parts and things working synergistically to achieve optimum function. So could you touch on, I know our time is very limited, but just a few ideas that you covered on how nervous system function might impact immune function?
On the cellular and biological level, these three subsystems and also the microbiome, but we'll tie that in, share chemical modulators. These include, we're about to have a visit from my dog Sagan. These include cytokines and interleukins, interferons, a couple of different molecules, tumor necrosis factor alpha, and TNF beta. There's a whole bunch of, don't drink my coffee, dog. It's gonna get all the more entertaining. A whole bunch of chemical modulators that are shared between these systems, such that when, for instance, IL-2 is produced, it won't just affect the immune system because it goes systemic. And anything that goes systemic would naturally be expected to access other systems. Therefore, when you release a cytokine or a hormone or a neurotransmitter or a neuropeptide from any of these, I'm using the nervous system, but you can release hormones from the endocrine system or interleukins or different molecules from the immune system, those would be naturally expected to affect the other subsystems. And that's what biology has been showing in the course of the past 20 years, that one molecule will exact a coordinated systemic supersystem response from all of the different subsystems in the supersystem. And that's very interesting to us as chiropractors because we talk about coordination and how things work in synergy. And anything that would obstruct appropriate coordination would be expected to diminish the capacity for human health, naturally. So it's been interesting to watch these fields of neuroimmunology and neuroendocrinology and the microbiome start to really merge into a bigger picture. And when I'm talking about a bigger picture, I'm talking about a series of articles published in Cell, Science, Nature, my favorite journals. They're all exploring these concepts of interrelatedness of these subsystems within the supersystem. So my question is, why aren't we?
Excellent question. And I remember in that Nature series, they had some prefatory remarks where they talked about how in the past, neuroscientists and immunologists kind of had their own silos and didn't relate much to each other. And now we're seeing more and more integration. And what I find incredibly exciting is that when we see some of this basic science research, these people are hungry for clinical strategies. They'll say, well, what kind of drugs can we use? Can we implant a vagal nerve stimulator? Can we somehow stimulate this with some sort of a pharmacologic agent? And we as chiropractors have for the duration been applying clinical strategies that were impacting systems that we didn't understand. So they understood the systems, but they didn't have the clinical application. We had the clinical application, but didn't understand the systems.
I find it amazing that those who discovered and developed chiropractic intuitively understood the interconnected nature of the systems of the body. That has always kind of thrown me for a loop. How could they possibly have known that 125 years ago? Well, they figured it out, and now science is actually starting to catch up, believe it or not, with the things that they were thinking over a century ago.
And to me, that's really exciting stuff. And I know we're almost out of time, so I would like to just invite the people who are viewing this clip to consider purchasing the entire series from the Immune Symposium. It's just a treasure trove of information that you can't get anywhere else. You'll see more of Dr. Amy and more of other people. I have a piece in there as well. And I think you'd really find it helpful in creating confidence, in creating effective communication strategies, and helping everyone to achieve some insight into how big this thing we call chiropractic is.
Mm-hmm. Expanding possibilities. Really, that was the bottom line for the whole symposium, was getting information out to people so that they could springboard and explore on their own and explore and expand their possibility of what they understand of chiropractic.
Exactly. The whole idea is human empowerment on the level of the patient, on the level of the chiropractor, and ultimately on the level of the planet. So thank you. And with Dr. Amy Haas, I'm Christopher Kent. Thank you.